stand by. We're about to begin. Good day and welcome to the Promoting Resiliency in At-Risk Youth conference call. Today's call is presented to you by the National Resource Center for Healthy Marriage and Family. Today's conference is being recorded. At this time, I would like to turn the conference over to Andrea Strahan. Please go ahead.
Thank you so much, Amber, and hello, everyone. I'd like to welcome you to the National Resource Center for Healthy Marriage and Families webinar entitled Promoting Resiliency in At-Risk Youth, How Encouraging Healthy Relationships in Youth Can Better Prepare Them for Adulthood. My name is Andrea Strahan, and I'm part of the Resource Center team. I'd like to thank everyone for joining us today. Before we get started with the presentations, there are a few housekeeping items I'd like to go over. Just to let everyone know, we will be taking questions at the end of the presentation, but we encourage you to submit any questions that you have throughout the duration of this webinar. To do this, find the question and answer pane designated by the letters Q and A on the top left portion of your screen. You can click on that portion of the menu bar to open the pane, or you can open the pane and drag it off the menu bar to display it as a standalone box. Type your question into the top box and then click the Ask button. You will receive an automatic reply thanking you for your question. This will free up your question and answer pane, allowing you to ask another question if you choose. If at any time you would like to view the presentation in full screen, please press the F5 button. You can hit the Escape button or the F5 button again to return to normal view. This presentation, a transcript, and a frequently asked questions document will be posted to our website, healthymarriageandfamilies.org, within about 10 business days. And with that, I will go ahead and turn the call over to Ted Futris, Training and Technical Assistance Coordinator here at the National Resource Center for Healthy Marriages and Families. Ted?
Thank you, Jill. Good afternoon, everyone, and thank you again for joining us this afternoon for this webinar. This is the first of a series of webinars that the Center will be offering. Today, our presenters include Robin Sinazul, who is our Project Director for the National Resource Center for Healthy Marriage and Families, myself, as well as Deborah Gilmore, who is our Family Safety Expert with the National Resource Center. And also we're happy to have Felicia Tuggle, who is with the Georgia Department of Human Services. She serves as the Director of the Georgia Personal Responsibility Education Program, which is housed within the Department of Human Services and Division of Family and Children's Services. And so we're very happy to have her on this call with us. She'll be talking a little bit about the efforts and programs that have been happening in Georgia that have integrated healthy marriage and relationship education into some at-risk youth programming. Our goal here this afternoon is to first outline kind of what the mission and the goals of the National Resource Center are. We'll also describe what healthy marriage and relationship education entails and its relevance to promoting positive youth development and health. We'll share some examples of how healthy marriage and relationship education can be integrated into youth services. Those are some of the things that Felicia will share with us. And we'll also, at the end, announce upcoming events and training opportunities in hopes that you might join us again for some future webinars on this related topic. As well, at the end, as a reminder, we will have question and answers, so please post those during the session, and we will take all of those questions at the end. And at this time, I'm going to transition over to Robin Sinazul, who is the Project Director for the National Resource Center for Healthy Marriage and Families. In addition to her work in the healthy marriage and responsible fatherhood fields, she also brings with her over 26 years of government experience specializing in strategic public-private partnerships to address community issues, including broad expertise with family strengthening, child welfare, workforce development, domestic violence, and poverty reduction. Robin?
Thanks, Ted. And welcome to this afternoon's webinar. The Resource Center is very proud to have you join us today. And as you can see on this slide, the mission of the National Resource Center for Healthy Marriage and Families is connecting healthy marriage education skills and safety net services as an integrated approach to strengthening families. From an academic perspective, healthy marriage and relationship education refers to a structured program that teaches skills and principles with a goal of improving relationship quality. And academics have studied marriage and relationship issues for many years. However, outside the academic environment, healthy marriage education was historically not widespread and was often viewed as kind of premarital education or as a last chance before divorce program. That's kind of different from the way we look at it. Now, the purpose of healthy relationship skills, including the skills that are listed here, is to support improved relationship resiliency and reduce risk factors that destabilize relationships and families. The passing of the federal legislation in support of healthy marriage education in 1996, followed by funding in 2005, has raised awareness of the value of healthy marriage education and increased the availability of programming, particularly in our challenged communities. And as you look at these specific skills, communication, conflict management, co-parenting, intimacy, friendship, commitment, self-care, finance management, and decision-making, these are all very important skills. Although the core components generally associated with healthy marriage education are important, the Resource Center focuses on interpersonal skills such as communication and conflict resolution, along with critical skills such as parenting and financial literacy. And the reason for this is because it allows us to be strategic in promoting skills that have the greatest potential for the broadest impact. Interpersonal skills are important in all relationships, within the family, within the community, and within the workplace, as well as parenting and financial literacy skills can reduce family stressors, improve coping skills, and assist families in achieving self-sufficiency. These skills also align well with the goals of our stakeholders. So thinking about our stakeholders, as you see in this diagram, we refer to them as safety net service providers. Specifically, the Resource Center is intended to support safety net service providers as they integrate healthy marriage education and relationship education skills into their service delivery systems. Our safety net service providers refer to federal, state, tribal, and local government agencies, such as those listed in the diagram, including child support, child welfare, Head Start, temporary assistance for needy families, as well as workforce investment boards and their community partners. And as you can see from the diagram, we wrap the family in these skills and connect them with all of these safety net service providers. Each of these providers is a touch point where we have access to families and can integrate these skills in different ways. So a lot of times we hear comments about, well, my agency doesn't serve couples or we serve young people, but the reality is that individuals benefit from relationship education skills just like couples do. Obviously, when you think about couple relationships, a lot of the challenges are that we have to start with ourselves before we can work with others. And these skills support getting and maintaining jobs, increasing financial self-sufficiency. They reduce co-parenting conflicts. They also can reduce parent-child conflicts and increase family stability and safety. The Resource Center provides lots of different resources to support safety net service providers in their efforts to integrate these education skills into their service delivery systems. We offer research that supports and promotes integration, resources, tips, tools to use and to share with families. We also offer training and technical assistance in support of our stakeholders. The way that the Resource Center is designed, we have the ability to support our safety net service providers at whatever level of engagement they're interested in. If they're interested in basic integration, basic level of engagement, just educational materials for their colleagues or clients to educate them on the importance of healthy marriage education, whether they're interested in partnerships, which would be the second level, to help develop partnerships to refer families to, or to have partners come in and provide resources to their families. And the third level, full integration, where we provide training materials to assist agencies interested in fully integrating healthy marriage education skills into their service delivery systems. The virtual resource center that we offer is very user-friendly. There are multiple navigation tools, as you see across the top. There are toolbars across the top. There are also tools down the side to make this a very easy to navigate environment. Our library has over 300 resources, We have new stakeholder-specific products being added each month. And in 2013, we will be launching our virtual training center, which will be offering product tutorials and healthy marriage education integration programming. As you can see, the website is designed like a toolkit. It's not very text-heavy. It's designed to help you find relevant research tools and resources in a very easy format. We hope that stakeholders will not only find tools to assist them in their work, but will also learn more about other stakeholders as they view the website. In working across stakeholder groups, it's often interesting to see that there are more commonalities than differences in terms of the challenges that service providers face in meeting the multiple needs of families. We also have a calendar that highlights a lot of the upcoming Resource Center events, as well as other stakeholder events that might be of interest to you and your colleagues. So I hope that you'll visit the Resource Center. We welcome any feedback that you have to offer. If there are tips, tools, resources that you don't see that you'd like to see, please feel free to let us know. And we hope that you will take advantage of using that, the calendar as well as the other information on the Resource Center website. And with that, I'm going to transition us back over to Ted, who, in addition to being our Training and Technical Assistance Coordinator, he's also an Associate Professor and Extension Specialist at the University of Georgia. Ted?
Thank you, Robin. All right, let me get to our next slide here. All right, so I'm going to talk a little bit up here about the developmental relevance of healthy relationships during adolescence. Why does it even matter that we talk with youth about this, teach youth about these relationship skills? And in general, we're seeing that healthy marriage and relationship education is developing into this nationwide network of programming for youth and adults. It's found in a variety of public and private settings, some of which currently receive substantial amounts of public funding. And so emerging trends that we see is that we see an increase in the provision of marriage and relationship education to youth in both in-school settings and out-of-school settings. We're seeing the addition of relationship components and skills training to services in different institutional settings, even adding technological ways to deliver this information. And as Robin mentioned, in 2013, we'll be launching some of those type of tools online to prepare stakeholders to deliver this type of programming. But in terms of its relevance to youth, I want to start off by first just kind of highlighting that this information, talking about healthy marriage and relationship skills to youth, is developmentally relevant. This is a teachable moment in the life course of an adolescent. Information about courtship may be especially relevant and timely for young people in middle and high school who are just beginning to have and understand romantic relationships. As you can see in the figure on the screen now, this is data from the National Longitudinal Survey of Youth, and it shows how as adolescents age, an increasing percentage of them report having had a having ever dated. And so by the time they graduate high school, or by the time they're 18, we see that 94% of those 18-year-olds report having been in a dating relationship. So many adolescents are experiencing these relationships. And research indicates that adolescent romantic relationships have a developmental purpose. And they foster adolescent development in areas of positive growth, including experimenting with possible selves, who they're going to be, what they want to do in their lives. Romantic relationships play a role in that. It also inspires them for future goals and what they want to do, as well as developing interpersonal skills, increasing their understanding of what it means to be a romantic partner. So expanding beyond just the daughter-son role to a partner role and taking on more of those responsibilities and experimenting with those roles. So it's very important to their social and emotional adjustment. And since adolescents' ability to form enduring intimate relationships is developmental in nature, they are highly concerned with their involvement in and their ability to manage the relevant issues of such type relationships. So sometimes, thus a lack of that information that they have, lack of accurate information and effective skills to manage those relationships can actually increase the risk of making poor decisions, and that results in negative outcomes, which then result in many of our safety net providers having to come in and intervene. And so here's an example. If you look here, another reason it's relevant is also it helps adolescents understand the time it takes to develop healthy relationships. What we see is, again, from the National Longitudinal Study of Adolescent Health, this data has shown us that the vast majority of teens, roughly 85%, view their first sexual relationship as romantic. And in the pie chart that you see on your screen, of those adolescents who were surveyed who had their first sexual intercourse within 12 months of being interviewed, of those in romantic partner relationships, you see that almost two-thirds of those adolescents report having had sex very soon after the relationship began, within the first 3 months. 24% of them report having had sex within the first month of the relationship. 37% within the first 3 months of the relationship. So you can see that a high percentage of adolescents are rushing into having sex in those relationships that they're forming. A lot of times it's because they don't know what's next. How does a relationship evolve? And so in addition to a high percentage of these teens having sex, it's also we also see a high rate of casual hookups following the initiation of sex. So after initiating sex, many teen relationships are short-term. 8 out of 10 first sexual relationships last 6 months or less. So these relationships dissolve very quickly afterwards. And there are serious costs to adolescents having sex, particularly if they become pregnant. Teen childbearing in the United States cost taxpayers, federal, state, and local, at least nearly $11 billion back in 2008, according to analysis that were conducted by the National Campaign to Prevent Teen and Unplanned Pregnancy. Most of the costs of teen childbearing are associated with negative consequences for the children of teen mothers, including increased costs for health care, foster care, incarceration, and lost tax revenue. Adolescent pregnancy and parenting often result in adverse health, psychosocial, and social economic consequences for the mother, the father, and the children. Some of these consequences include greater health risks, poor psychological functioning, decreased rates of school completion, higher levels of relationship instability, increased risk of unemployment, greater dependence on welfare, and so forth, particularly for low-income ethnic minority youth. As well, relationship education can help teach young people how to recognize patterns of healthy versus unhealthy relationships. This is sometimes referred to as helping them develop emotional intelligence. Learning what is healthy and what is not can help adolescents gain a better understanding of the feelings that they experience and how to manage those feelings. And there's an alarming rate of relationship violence that occurs among adolescent dating partners. Here are some stats, for example, from a national survey that was conducted by the Teenage Research Unlimited group, which was commissioned by the Liz Claiborne Incorporated and the Family Violence Prevention Fund, which shows that 47% of teens who were surveyed experienced some sort of controlling behavior from a dating partner. 29% experienced physical, sexual abuse or threats. 24% experienced some type of tech abuse, for example, receiving voice messages or text messages about themselves, or Facebook postings that were negative. 11% experienced repeated verbal abuse. And some more recent stats from Harvard School of Public Health show that about 1 in 5 girls experience physical or sexual dating violence. A study by the Center for Disease Control showed that 1 in 10 high school students report being hit, slapped, or physically hurt on purpose by their boyfriend or girlfriend during the past 12 months prior to the survey. And again, here, there's some serious financial costs for intimate partner violence. National costs estimate nearly $4 billion each year in terms of medical and mental health care services for those who've experienced intimate partner violence. And And so these are serious taxpayer costs and lots of efforts to reduce the risk of intimate partner violence. And healthy marriage and relationship education can actually help decrease the tendency of one selecting an abusive partner, helping them understand and identify what those warning signs are. What are the signals that you need to look out for and remove yourself from a situation, and how to get out of an abusive type relationship. Another reason that healthy marriage and relationship education is relevant for youth is that it also can help them enhance critical relationship skills. You know, skills such as communication, how to manage conflict, helping young people understand that conflict in a relationship is normal, and it's how you handle the conflict that differentiates a healthy versus unhealthy relationship. So it empowers them to make good choices, stand up for themselves when needed, so that they can maintain those healthy relationships over time. Also, acquiring these skills now as youth have applicability to different contexts, not just dating relationships, but they can apply these in different situations, including peer interactions. If they're employed, it can be used in employer-employee relationships. There's even research that shows that youth who go through relationship education actually have less conflict with their parents. Teachers report better relationships with the youth who've gone through relationship education. So those skills that they learn can be applied in multiple contexts. Also, possessing these skills early on as adolescents can benefit them into adulthood when they translate these skills into, in their employment situations, developing adequate support networks and healthy marriages in the future, as well as the appropriate parenting of their own children. These relationship skills can be very helpful in parenting as well. This will subsequently increase overall levels of individual functioning and self-sufficiency, while simultaneously decreasing potential reliance on support services such as TANF, child welfare, and or domestic violence interventions. And it also increases the likelihood that they will build future healthy relationships. And so we have a poll question here just to kind of gauge and see what you all think. What percentage of high school seniors do you think say that having a good marriage and a family life is extremely important to them? If you would, please take a moment to click your response. And right now we kind of have a split there. We got some differences of opinions. We have about 40% feel 70 to 85% feel that it's extremely important. We have around 23% who think between 0 to 40%. Well, let's see on this next slide what teens actually are reporting. This is data from the. Let me go here to the next slide. This is data from the from the Monitoring the Future survey, which was conducted by the University of Michigan. And it shows that roughly 70% of boys, 71% of boys, around 82% of girls believe that it's extremely important to have a good marriage and a family life. So those of you who are in that range, congratulations, you kind of have an idea of how these high school seniors think about marriage. But as you can see, that marriage and having a healthy family life someday are very important to these youth. However, what's concerning is they're just not certain that it's going to last. Consistent with our stable and high divorce rate of nearly 45 to 50% each year, we see that when asked how likely they will stay married to the same person for life, we see that between 57 to 63% of high school seniors feel that they will stay with that person for life, which means that about 40% aren't sure that they will. And that's unfortunate. That's a little scary. So we also see that relationship education for youth can also help reinforce some of those positive models and attitudes. So we see that many youth are growing up experiencing divorce, and they have that reservation that I don't know if my marriage will last. My parents' marriage didn't last. So it might alter that learned model or that negative attitude about marriage. We also, though, are seeing that an increasing percentage of folks are cohabiting, and they're becoming more accepting of that. But for those who are reside in a healthy two-parent married household, relationship education can reinforce what they see their mom, dad, or their caregivers exhibiting and modeling. But for those who aren't, it can alter some of those negative attitudes. For example, we see that the out-of-wedlock pregnancy rate has consistently increased each year in the United States. And many youth are seeing this, are surrounded by this in their communities. And what's interesting is that each year, based on this same survey conducted by the University of Michigan, high school seniors are increasingly more accepting of out-of-wedlock childbearing. When asked whether having a child without being married is experimenting with a worthwhile lifestyle or not affecting anyone else, we see that most recently nearly 55% of high school seniors felt that it was okay, which is really concerning. You can see how that's really changed since the survey was initially conducted back in 1976, and it coincides with the increasing rate of out-of-wedlock childbearing. Similarly, we see an increasing openness to cohabitation. Cohabitation rates have steadily increased each year in the United States, and so we see that those that high school seniors are agreeing, or mostly agreeing, that usually it's a good idea for a couple to live together before getting married in order to find out whether they really get along. And we see research shows that cohabitors are at higher risk for marital instability. Now, it's not to say that all cohabitors are at higher risk, but there are some qualities of cohabitators that present more risk. And one research kind of shows that reason you go into cohabitation is really important. If you're going in to test whether or not this relationship will last, you're at higher risk. And it shows that the problem with cohabitation, the risk with cohabitation, is increased sexual activity, increased likelihood of out-of-wedlock pregnancy, and there's no strong commitment for that couple to stay together in cohabitation. So relationship education can help adolescents understand the risks, the consequences of out-of-wedlock childbearing, of cohabitation, so that they can make smart decisions, their own decisions, but hopefully smart decisions as adults, as they're making these adult decisions later on in life. Next, we also talk about, does relationship education actually make a difference? What impact does it have on adolescents? And the research is really new in this area. It's really beginning to emerge. It's emerged during the last 5 years, partly as a result of a lot of the federal funding that supported a lot of healthy marriage and relationship education for adolescents. And we're seeing a lot of research emerging showing early signs of quality impact. First, it's changing how they think about marriage and relationships. Positive changes in their attitudes, their expectations about marriage. It also has increased their knowledge and use of these relationship skills. We're seeing research showing that they better understand how to use certain communication skills like speaker-listener or active listening, how to manage conflict and differences, and consequently we're seeing changes in how they interact and handle conflict, a decrease in the frequency of conflicts with peers and partners. It also is improving their understanding of relationship violence and abuse. They are understanding what the warning signs are and when and how to get out of an unhealthy relationship. recent research by Dr. Kerpelman and her team out of Auburn University have actually recently shown that these changes benefit youth across diverse populations, low and high income, white and African American, in different age groups. But there's still more research that's needed in this area. And I think as more practitioners, more stakeholders begin integrating relationship education into the services and programs they offer, there'll be more opportunities to actually research and study that. In fact, Felicia will talk here shortly about the PrEP project, where we're doing some of that evaluation as well. Last, I just want to touch on, for those of you who are new to this area and are thinking about integrating relationship education, just some things to consider based on lessons learned from others who have actually been conducting relationship education. First, there's just a range of settings where youth can be reached. This can be offered in school settings, after-school settings, job sites, community organizations, faith-based organizations, great partners, and there's a strong interest within the faith-based community for this type of programming and service. The class makeup, the location should all be appropriate and not hinder the implementation of the curriculum that's being offered. And so you just want to think about the setting, and is it welcoming, and is it open enough, and do you have enough space to keep it interactive. There are a lot of great curricula out there that are very engaging, less lecture, more interaction with this age group. And you want to balance the length of the program with the program objectives. Relationship education curricula vary in length. Some are designed to be delivered over a short period of time, 1 or 2 days, while others are more extensive and may take a couple of weeks because they're multiple lessons. So the challenge is often fitting the curriculum, fitting the program in during school hours or the availability of youth in after-school settings. So how long are youth available for multiple session programs? Something to consider. For example, foster youth may be at a center for a very brief time, so will they get the full dosage of a program? Also, you want to make sure that the curriculum is relevant to your youth. You want to choose curriculum and resources that are developmentally appropriate. Material should be relevant and engaging to the audience for which it's being presented, especially in terms of the age, the socioeconomic status, the ethnicity, the religion, the gender of the youth. And you want to really maintain an adequate level of engagement to keep the youth excited and interested so they keep coming back. The quality of the facilitators also makes a huge difference. While some relationship education curriculum may not require facilitator training, I strongly encourage you to identify someone who is experienced and knowledgeable of the curriculum to provide a training for your facilitators. It really makes a difference from just reading the curriculum content versus going to a training and seeing it happen. My experience with our county extension educators, for example, some who get the curriculum, go out, implement it, and they kind of learn as they go. But then they come to a training, and they're like, boy, I wish I'd known that before. It would have made implementing that lesson so much easier. So if possible, try to get trained in the curriculum. But there are some great curriculum out there that provide descriptions on how to implement, and so you might kind of learn as you go. Last, you want to find innovative strategies to engage young people and their parents to encourage ongoing participation. You might offer the program for young people while also simultaneously offering something for the parents on how to talk to their teens about relationships or what's happening during adolescence, so they can learn how to connect with their adolescent, because many parents struggle during that adolescent phase in connecting and talking with their teen. And build community support for the program. That's vital to sustainable programming. Find community partners that are passionate and interested and that will support your efforts in this area. So that's all I have right now, and what I'm going to do is I'm going to turn this over to Deborah Gilmore. Deborah is our family safety expert with the National Resource Center for Healthy Marriage and Families, and she's going to talk to us a little bit about integrating healthy marriage and relationship education at all levels of prevention. Deborah?
Thank you, Ted. Everything we do communicates something to someone somewhere. So when we hear phrases like domestic violence or intimate partner violence, child abuse and child neglect, we usually picture scenes like the ones on this slide. We associate these issues with poverty given their statistical correlation with poverty, yet they cross socioeconomic boundaries, and there are many people who are poor and are not violent or maltreating parents. These photos show the worst, but also the minority of domestic violence and child maltreatment outcomes. In reality, there is a lot of variation in what violence and maltreatment can look like. From a single incident of physical abuse due to unusual stress or leaving your children home alone because of a work scheduling issue, to complex and chronic problems, substance abuse, mental illness, that are intertwined with poverty and that may be plaguing multiple generations of a family. We may think about the police or child protective services as the responsible helping agencies. But in reality, there are a lot of agencies and people who can and who do influence impacted lives. My goal over the next few minutes is to broaden your views, regardless of your role, about a range of prevention strategies that integrate healthy marriage and relationship education to help keep families and youth safe. In the world of health and well-being, some of you may already know, we talk about 3 levels of prevention. At that tertiary level, that top level on this slide, whatever it is that we're trying to prevent, whether it's violence, child neglect, or teen parenting, that thing has already happened, and we're trying to prevent it from happening again. Most, if not all of you, either have protocols in place for calling in one of those first responders when you know or suspect that a client is experiencing violence or child maltreatment, or you should have those protocols in place, or you or your agency are those first responders. We have a wide variety of folks who are on the call today. Those first responders will address immediate safety, and sometimes that is all they're able or mandated to do. So if you are a first responder and you respond to a family crisis, you actually may be using some of these skills that we've been talking about. You are using your own communication and conflict resolution skills to negotiate and diffuse the situation. Preventing violence, abuse, or neglect from happening again at this level requires partnerships and purposeful programs. It takes efforts to engage the impacted family members, and it takes assessment, goal planning, and skill development to give individuals tailored help, whether it's strengthening their coping skills, understanding unhealthy relationship signs and patterns, or working on healthy communication while building financial capability. It takes time and long-term integration of healthy marriage and relationship education skills at this level to help change or separate from negative patterns and achieve or reestablish self-sufficiency. At the secondary level of prevention, we're targeting families or youth whose statistics tell us are at higher risk. Great secondary prevention strategies include partnering with healthy marriage and relationship education practitioners who can help both your staff and family members to strengthen marriage, co-parenting, and relationship skills, and by creating peer mentor programs that integrate relationship skills. Our next presenter, Ms. Tuggle, is going to give us an example of prevention at the secondary level, and you'll hear about how she's helped at-risk youth identify behaviors that lead to unsafe or unhealthy outcomes. Lastly, primary prevention strategies are the ones that are geared to the general public, with a general goal of promoting health and well-being and strengthening families to prevent abuse or neglect in the community. Increasing access to services. For example, offering healthy marriage and relationship education skills brochures or sessions to all parents that come across the program, regardless of that family's family structure, and programs may be, for example, Head Start, public health facilities, anywhere really that within that safety net that Robin talked about earlier. Those are all examples of primary prevention. Another example of promoting family safety through relationship skills at this primary prevention level is by modeling open communication and using positive language about those close to you in your everyday life, for and with your significant other, your children, your neighbors, your friends, your work colleagues, and the youth with whom you work. Everything you do communicates something to someone, somewhere. I'm next going to take this and turn it over to Felicia Tuggle. Felicia, as Ted mentioned, is with the Georgia Department of Human Services Division of Family and Children's Services. She also serves as the state director of a federally funded teen pregnancy prevention program that's being implemented across 10 counties through her agency and public health after-school programs. Felicia?
Good afternoon, and thanks for joining us. So I'm really going to talk more about how healthy marriage and relationship education is being integrated into youth development programs in Georgia. So I'll talk a lot about what we're doing in Georgia specifically to mitigate a lot of those risks that Ted described earlier. And as State PrEP Director, PrEP stands for the Personal Responsibility Education Program, and it is a federally funded program that's state administered, and it's designed to educate teens on both abstinence and contraception to prevent teen pregnancy and sexually transmitted diseases. Our program targets at-risk youth population between the ages of 10 to 19. And in addition to education on abstinence and contraceptive use, PrEP provides services that prepare young people for adulthood by implementing things such as healthy relationship and marriage education, positive adolescent development, financial literacy, employment skills, and healthy life skills. So what you see in front of you is kind of an organizational chart of how our PrEP program is set up. As Deborah mentioned, we are specifically housed within the Department of Human Services, the Division of Family and Children's Services, which is the state child welfare agency for Georgia. And within Georgia, our Georgia PrEP initiative, you see we have our sex ed training and technical assistance coordinator. We have marriage and relationship education training and TA coordinator, and then we have our external PrEP evaluator. So we have funding that goes directly to our DHS, Department of Human Resources after-school program, as well as we provide funding to our Department of Public Health through a collaborative agreement with them. And those DHS after-school programs specifically provide PrEP programming with CBOs, so those are community-based organizations, and they are in a variety of settings. Some of those settings include schools, some of them may be faith-based organizations, and things of that nature. The Department of Public Health, the way that they provide PrEP programming is through their Adolescent Health Youth Development Centers. These were previously a lot of the teen clinics across the state. And in addition to providing programming directly in those Adolescent Health and Youth Development Centers, our public health sites also go into some of our child care institutions, which would be considered like your group homes, and they work with other child placement agencies within our child welfare agency to make sure we provide services specifically to youth who are in foster care. So some of the priority populations that we serve through the Georgia PrEP initiative are youth in foster care, which is having housed specifically within the Division of Family and Children's Services. This is clearly one of our high priority populations, but outside of youth in foster care, we also provide services and programming to homeless youth, to youth who are living with HIV or AIDS, pregnant and parenting youth who are under the age of 21, youth residing in areas with high teen birth rates. For us, that translates to about 10 counties across the state. The 10 counties that we're working in collectively make up about 60% or account for about 60% of the teen birth rates in the state. So we have really focused and targeted intervention in those areas that we know we have high teen pregnancy rates. We also serve out-of-school youth and then culturally underrepresented youth populations, including Hispanic, African American, Native American youth, as well as youth who identify as lesbian, gay, bisexual, transgender, or questioning. So as you can see from our priority populations, this represents primarily the bulk of those subpopulations that we all think of when we think about high-risk youth. So next I'm going to talk to you a little bit about what specifically we're doing or how we have specifically integrated healthy marriage and relationship education into our PrEP services within Georgia. As I mentioned before, we have our Department of Public Health, Adolescent Health and Youth Development, and our Department of Human Services after-school site, they submitted proposals in response to an RFP that we put out. Through a peer review process, we evaluated, scored those applications as you would any other RFP process. The successful sites then went through the Getting to Outcomes framework, and I can elaborate on that if we have enough time at the end. But that's, in brief or in short, that's really more so for administrators, and it's a framework that kind of walks programs through to make sure that they actually get to the outcomes in programs that the programs are designed for. So a lot of times people kind of get started, they develop programs, but they don't necessarily have all of the programmatic components to get them to the larger objectives and outcomes that they want to achieve. So the GTO framework is designed to walk agencies through that process. And then sites were able to select their sex education curriculum, the ones who were successfully funded through us. And it's important to note that sites were able to select those sex ed curriculums based on a community needs assessment, so they were able to select the curriculums that they wanted to use. Some of our sites chose to use curriculums that focus more so on abstinence, while other sites chose to choose curriculums that focus more on comprehensive sex ed, and that would include things like contraception, birth control methods. All of our sites are using the same marriage relationship education curriculum that was selected at the state level, so they all are using that same curriculum. The sites were then trained on their sex ed and marriage relationship education curricula prior to beginning implementation. And to do this, because we have these multiple components within PrEP, it was really important that our marriage relationship education contractor, who's providing training and technical assistance, work really closely with the contractor that we have providing the training and technical assistance on the sex ed curriculum, so that at the state level we could ensure that PrEP was being seen as one seamless program as opposed to two separate programs. Just kind of historically within the field, we're doing a much better job now, but teen pregnancy has kind of been siloed away from marriage and relationship education. So to bring those two together, which a lot of research is starting to do that now, but it was important for programming reasons that we made sure that those two contractors really work together. And an example of how they were able to do this, for example, one of the lessons in the marriage relationship education curricula focuses kind of on the 7 principles of dating. And it also goes into talking about adolescent development and those brain chemicals. And they were able to link that back to the sex ed curriculum by helping teens recognize how they have a range of feelings and emotions, infatuation and things like that, how they may choose to engage in risky behaviors just kind of based on these other heightened emotions that they may have been experiencing. And Ted spoke a lot about that earlier as he talked about why marriage relationship education is so important for youth. The training that we provided for all of our sites, it consisted of a 3-day training on one of the approved evidence-based sex education curricula, and that approved list was originally developed from Department of Health and Human Services. They selected 28 curriculums that had been identified as evidence-based sex ed curriculums. Within the state of Georgia, we narrowed that down specifically to 5 curriculum that our subawardees were allowed to select from, and again, they selected those curriculum based on their community needs assessment. Ongoing TA was provided in a variety of forms throughout. TA took the form of phone calls, regularly scheduled conference calls, as well as site visits. And then just to kind of continue supporting the growing body of literature around marriage, healthy marriage and relationship education, all of our sites completed fidelity monitoring logs at the conclusion of each lesson that they taught. And those things like that, the fidelity monitoring tools help to capture things like which lessons were taught, if those lessons were being taught as intended, the level of student engagement, and et cetera. So thus far, kind of what lessons have we learned to date? I'm sorry. What impact has been reported? So thus far, we see that marriage relationship education has helped youth identify the social emotional factors that can contribute to risky sexual behaviors and dating violence, and it's also helped them to modify their personal behaviors accordingly. The marriage relationship education programming has helped youth to learn to effectively relate to others in productive and healthy ways. And for our older youth, marriage relationship education has really done a great job helping them identify how some of their patterns of interactions with their parents are also showing up and being reflected in their relationship with their peers, as well as with their relationships with their dating partners. We also have seen that youth report that marriage relationship education has helped them identify personal values, set goals, improve their communication skills, and enabled them the opportunity to develop appropriate skills for ending relationships. So again, this kind of ties back into a lot of the things that Ted highlighted in talking about what the research has shown. We're already finding in our first year of programming that we're seeing things that are consistent with what research has shown. Marriage relationship education has also helped youth recognize the responsibilities that come along with parenting, and it's motivated them to either abstain, delay, or reduce sexual encounters. Marriage relationship education has also helped our teens recognize how the importance of parents' relationships and why they matter for children. So, for example, through some of the activities that they do in the curriculum that we selected here in Georgia, teens were able to see through the eyes of a child. There's a specific activity within the curriculum that we're using that lesson is labeled through the eyes of the child. And at one of our sites, there was a young teen male, after he had gone through that lesson, he came up to a facilitator kind of to share, to disclose some information, but then also to seek some guidance. And he specifically wanted guidance around going through that lesson, recognizing how important a parent is to a child, their roles, their responsibilities. He stepped up to the plate and acknowledged that he had fathered a child with this young lady, and up until that point really had ran away from his responsibilities. But after going through, this activity or this particular day's session in this marriage relationship education curriculum, realized the responsibility that he had to the mother of that child, to that child as well. And he was really ready to make, some concerted efforts to take on the responsibility that he had assumed by producing a child. And then lastly, healthy marriage relationship education has helped you recognize red flags for abusive relationships and the various ways violence and abuse manifest themselves in adolescent romantic relationships. It has helped teens understand and learn how to manage the emotional aspects of their relationship, both positive and negative emotions. So, for example, teens learn that positive emotions, things like elation or infatuation, how they can cloud their judgment and lead them to make unhealthy decisions like engaging in risky sexual behaviors. But as well with their negative emotions like jealousy and anger, they better understand how those negative emotions, if not handled appropriately, could lead to things like teen dating violence. And then I'll close with just a couple of the lessons that we have learned to date. Again, this is our first year of implementation with our PrEP program, and most states who are implementing PrEP are also wrapping up PrEP programming around the same time this year. So there should be a lot of results coming that states will be reporting on, specifically those states who have chosen to implement healthy relationships as a part of their PrEP programming. The Fed should begin to start collecting a lot of data around this in the next year. But some of the lessons that we've learned to date is that older youth just over and over again told us that they wish they would have had the information earlier. And then we found that a lot of the younger youth didn't always feel that the information was relevant, especially if they were not yet dating. And this is probably most applicable to some of those like 5th, 6th grade students. Around 7th and 8th grade, they've kind of begun dating relationships, and especially our 7th and 8th graders who reside in the metro area. But some of the ones outside of the metro area, we are a southern state, so outside of the metro area may not have begun dating, and they may have not felt like it was as applicable or relevant for them at that time. We also have learned that marriage relationship education and sex education programming, both whether it's abstinence or whether it's comprehensive sex ed program, are a perfect marriage. And we found that just by really helping youth learn the differences between healthy and unhealthy behavior, that the teens really have an opportunity to gain the valuable skills needed to both understand the plethora of feelings that they experience, as well as manage their feelings appropriately. And by developing these skill sets, we can help these youth avoid other risky behaviors. And we know that every day tens and thousands of youth around the country rely on programs and services that are designed to address the many needs that they face. And we also know, we hear a lot, that youth professionals, they often see the need and the importance of helping adolescents develop healthy relationships, and they really want to help them develop those relationships, but oftentimes they lack the skills, the knowledge, or the resources to do it. And we really learned that through our PREP initiative, that youth-focused healthy marriage relationship education curriculum are a great way to provide this valuable skill set to youth. We learned early on that extension agents are a great resource because many of our agents already have been trained in such curriculum, and they're able to offer training and programming to youth professionals either free or at a reduced cost. So I guess one of the take-home messages I would definitely want to leave everyone with is that the youth who participated really, really loved the marriage relationship education, and I think so more because it's a break from the typical type of programming that they get. It breaks away from the core curriculum, subject matter programming, and academic. It's more of an academic nature, and it really is interactive, allows them to share their voice. And by helping youth develop those healthy dating patterns in adolescence, we really do enhance their efficacy to build healthy, stable partnerships now and until their adult lives. And with that, I will transition back over to Ted.
And actually, we're going to transition back to Robin, who's going to highlight some of our upcoming ways that the National Resource Center can help.
Hi, thanks. That was very informative. Thank you very much. Okay. Moving us along here. Andrea, can you move the slide? Okay. Sorry, we had that 3-second delay apparently. So we've heard all these great ideas. We've heard a lot of information today about youth and how healthy marriage education can be integrated and the benefits of integrating healthy marriage education and the importance of this information reaching our youth. So the National Resource Center can help in a lot of ways. As I mentioned earlier, we have a lot of resources on our virtual resource center. The new resources are coming on to the center monthly. We have new information, new links to other sites where there's great information, also some new products that are stakeholder specific that are being developed and added to the Resource Center library. We also have upcoming webinars scheduled for August where we're going to have a series of 3 different domain-focused webinars that discuss actual integration of healthy marriage and relationship education into various stakeholder services. We are also going to be having some online training opportunities, as I mentioned. We're going to be doing some regional, state, local, and tribal training and collaboration opportunities. We have several scheduled for September, and we'll be doing even more in the coming year. So I hope that you will all take advantage of these various opportunities. Stay connected to the Resource Center. If you didn't indicate an interest in signing up for the listserv whenever you first joined us for this webinar, I hope that you will take advantage of that opportunity. We do have some questions, some poll questions that we're going to ask you to please stay with us long enough to fill out at the end of this. But right now we want to open it up for questions from you. If you have not typed in your questions already, which I believe there are a couple already in the queue, please do so. And with that, I will turn it over to Andrea to facilitate the questions.
Great. Thank you, Robin, and thank you so much to everyone for your presentations today. At this time, we'd like to transition to our question and answer period. We've had a few great questions submitted, and I'm going to pose them in just a moment, but I'd like to remind everyone to please feel free to continue to submit your questions using our question and answer function. So our first question is for Felicia. And Felicia, the question is, what advice do you have on first steps for programs that want to incorporate healthy marriage and relationship education into existing programming?
I guess the first step, because PrEP is a national initiative, I would say they may want to see who their state PrEP coordinator is, because some of that work may already be going on in the state, and it may be a great opportunity to tap into an existing funding structure as well as existing resources. If they're in a state perhaps that may not have such programming, or if it's a smaller nonprofit, I would suggest that they check with their local land-grant institution in that state. Many of the land-grant institutions would have extension components connected to them, and those agents have more than likely been trained in healthy marriage relationship education and could really provide a lot of consultation, again, probably at little to no cost as to how to go about doing that.
Okay, wonderful. And we just received a kind of a follow-up question onto that, asking if you can recommend resources where people can find strategies or find a list of programs.
I know that the National Resource Center, that's going to be a part of their website. So that'd probably be a first place for them to go and check, and that's www.healthymarriageandfamilies.org. And I'm sure that they'll probably bring back up information on how to contact the Resource Center at the conclusion of this webinar. So that would be a first place to go to. The Department of Health and Human Services, they host a lot of that information, specifically their Administration for Children and Families. If they go to that website, I'm not sure if the National Resource Center has links over to ACF, but that may be one of the places that they can also go. And then they may also want to, check with the CDC for other resources.
Okay, wonderful. Thank you. And this question, following up on that, and we can open it up to any of our presenters today, but Felicia, if you know, please speak to this, is where and how can I find youth-appropriate activities to use while holding RE youth workshops?
Yeah, I'll take that on, Jill. A lot of the curricula that are out there, while they are sequenced so that they build on each other, if you don't have the time to deliver the entire curriculum in sequence, many of these are developed in such a way where you could pull pieces out. So if you wanted to just do a 30-minute session on managing conflict, you could pull that content out. Or if you wanted to do a class on understanding the difference between unhealthy and healthy dating behaviors, or how to break up, or warning signs of abuse, you could pull those type of activities out from some of these curricula. So unfortunately, there isn't a place where you can just get that one piece. Usually these are all incorporated into curricula, and so some of those curricula will be highlighted, I know, on the National Resource Center for Healthy Marriage and Families, but there are also a variety of curricula that are out there. For example, I know the Dibble Institute is an organization that develops and offers a variety of youth-focused relationship education curricula that you could explore. And they're probably one of the few that I know that really specialize in youth-focused relationship education, and that's the Dibble Institute.
Okay, great. And then we'll have time for one more question here, and any questions that don't get answered today will be put up on our website. And just to remind everyone again, the slides from this presentation, a transcript of this presentation, and frequently asked questions, including any questions we weren't able to answer today from our presenters, will all be up on our website, which is healthymarriageandfamilies.org, within 10 business days. For our final question, for Felicia, what factors do you think are most important in selecting a curricula if someone wants to start offering healthy marriage and relationship education?
I would really base that kind of on the demographics of the population that they would serve. Most of the curriculum that are out there around healthy marriage, relationship education really can be targeted towards a range of populations. So there are not a lot of them that have been developed that are so specific to certain ethnic or racial groups or, cultural things like that. There may be some that may be more relevant for males or for females. But I think the things that are most important to consider would just kind of be the age of the youth that you plan to serve. Some curricula, the language in it, may be more appropriate slightly for an older population like high school students, more so than your middle school students. You also want to think about just kind of the range of the settings where youth can be reached that may have some influence as to which curriculum that you select, balancing out the length of the program with the program objectives. So, again, looking back at the length of the curriculum and the amount of timing that you have for programming. For us in Georgia, we had our grantees, they were able to select from 3 different models in which they wanted to deliver. They were able to do it once a week. For an hour, they could do it twice a week. They could do it once a week for an hour and a half. They could do it twice a week for like 1 hour. So, again, just kind of thinking about the timing, and then you want to make sure that the curriculum is relevant for the youth. Those will probably be the core things that I would say you need to consider when you're selecting your curriculum. And if you have intentions on engaging parents, you might want to select a curriculum or look for a curriculum that already has kind of a built-in component for how to engage parents as well.
Okay, wonderful. Thank you, Felicia, and thank you to all our presenters today again. Right now, I'd like to ask everyone to participate in a few final poll questions. And just to let you know, all of your responses are anonymous, and the purpose of this is to help us plan our future webinars. So our first question is, please rate your overall satisfaction with today's webinar. And we'll take just a moment to give everybody a chance to submit their responses. All right, we'll take a couple more moments. If you haven't had a chance, please go ahead. Okay, and then our next poll question. After today's webinar, I understand how healthy relationship education skills are relevant to adolescent health and later adult relationship choices. If you want to take a minute and go ahead and submit your answer. Okay, great. And our next question. Are you likely to talk with colleagues about integrating healthy marriage and relationship education into your current services? We'll take one more moment for anyone who needs to submit. All right, and our final poll question today, are you likely to use the National Resource Center's resources, training, or technical assistance in the future? All right, well, I'd like to thank everyone so much for joining us today for our webinar, and have a great day.
Thank you. That does conclude our conference. You may now disconnect.